Welcome back to another lecture of Dental Pathshala, where we help you understand and learn dentistry better and easy way. And this is a continuation of the Express Revision course for pedodontics. And before we get started, make sure you subscribe to the channel and hit on the bell icon so that you don't miss any of our exciting videos. And if you are interested in watching the more interesting videos like this, you can watch in the playlist of our channel. And if you are interested in reading the notes, you can check out our website www.x2.com. You don't have to take down the notes of this particular video lecture. The link is provided in the description box below for the notes of this video. So guys, let's get started with the today's topic, which is the space maintainers. So what happens? There is spacing present in the primary teeth, which we have already studied. So primary teeth, they make more space for the permanent teeth to erupt. But what happens? If there is discrepancy between the arch dimension and the tooth dimension, it leads to the crowding. So if there is no spacing present in the primary teeth, it usually makes the crowding in the permanent dentition. Or if there is early loss of the primary teeth, then it leads to the delayed eruption of the permanent teeth because there is no space. So what we have to do is, we have to make the space. So early loss of primary teeth usually leads to delayed eruption, because all these teeth, they get drifted mesially. So the teeth which is supposed to erupt does not erupt in the eruption sequence. So delayed eruption of the permanent teeth. Now let me give you an example to understand this line. Now what happens? Say suppose this is your D. Say here is your E. So D is the primary first molar, E is the primary second molar. And then guys, here is what C6 is supposed to erupt. Excuse me guys. So what happens guys? This is where the permanent first molar is supposed to erupt. But what happens? Say if there is early loss of E. So what happens? The permanent teeth will erupt. The 6 is going to erupt somewhere here. Right? So there is no space for the premolars. So this is why there is delayed eruption of the permanent teeth, because of the migration which happens. Now what happens guys? There is a physiologic space which is present in the primary teeth, which we called it the primate space. So there are two spaces, two physiologic spaces. One is the primate space, another one is the leeway space, right? We'll discuss that. So primate space is, if you remember, it is mesial to the maxillary canine and it is distal to the mandibular canine, which we have already covered. So mesial to maxillary and distal to mandibular. Usually it is somewhere around say 1.5 millimeters, but it is lost early at the age of 6 years, while there is eruption of the permanent molars. So permanent molars are the first permanent teeth to erupt. So this primate space ends at the end of the primary dentition, right? So next physiologic space guys we have is the leeway space of Nance. So remember, it ends with the E. So we have E space. This is also known as E space. You can remember it, that it ends with the letter E, Nance. So leeway space of Nance we have already discussed. It is the differences between the mesiodistal area of the dimension of the C plus D plus E, which is wider than 3 plus 4 plus 5. So since there is a difference in this space, since we get some space, this space is utilized for the eruption of the permanent teeth. So this space is more in the mandible, which is 1.7 millimeters on each side, guys, and less in the maxilla, which is only 0.9 millimeters on each side. This is what we have already covered. But this space is also lost at the age of 11 to 12 years with the exfoliation of the E. So after the exfoliation, that means shedding of the E, exfoliation of the E, the space is lost. That is why we call it the E space. So after the primary second molar is shedded, this space is lost. So we have studied that up till the year of age 6, the primate space is lost. Up by the year of 11-12, the leeway space of Nance is lost. Now guys, if there is early loss of primary teeth, then the space is occupied. There is no more space for the permanent teeth to erupt. There is crowding, delayed eruption of the permanent teeth. So that is why we need to restore this space. That is why we need to manage and hold the leeway space before the primary teeth are lost. And there comes the role of the space maintainers. So what are these space maintainers? These space maintainers are the devices which are going to hold the space after there is premature loss of the primary teeth. So basically these are reactive. So they are just going to hold the space. They are going to hold and maintain, I can say, maintain the space. There is something known as space regainers also. Now you have not maintained the space and the space is lost. So what you need to do is, you need to do the active orthodontic treatment and then regain the space which is lost. So that is a retroactive. And maximum you can gain up to 3 millimeters of the space. And remember that the maximum space is lost within the 6 months after extraction. So I am going to write first 6 months of extraction. And most immediate losses within the 76 hours. So guys, the space maintainer should be placed ASAP after the primary teeth are removed, as soon as the primary teeth are removed. So as soon as we are doing the extraction of the primary teeth, we need to put the space maintainer for the permanent teeth. So guys, it requires 4 to 5 months to move the teeth to penetrate the 1 millimeter of the bone. So mean velocity, daily velocity of eruption is seen to be 71 micrometers per day. And there is rule of 7. Rule of 7 are also known as the Mickey's mental rule. So this is a rule for the primary molars. Primary molars. So there is delayed eruption if the extraction of the primary molars is before the age of 7. So there is delayed eruption. And there is early eruption, or we can say acceleration in the eruption after the age of 7. Age of 7. This is the rule of 7. So guys, let's have a discussion about the space maintainers. The one in the diagram you can see over here is the band and the loop space maintainer. So when the space maintainer is used, why this space maintainer is used? See, if you can see here, the band and loop space maintainer is basically unilateral. So it is only placed on one teeth, and let's make a band over here. So guys, this is a band which is placed on the tooth, and say suppose if there is a unilateral loss of the primary first molar, and either it is before the eruption of the permanent molar or it is after the eruption of a permanent molar. So it is used to preserve the space by the early loss of the single primary molar. So a band is created first of all, and then a loop is soldered to the band. So you can see here there is a loop which is soldered to the band. So this is a loop which is formed of 0.36 wire, and we have to make it, if you can see here, we have to make it 1 millimeter above the gingiva of the gingival tissues, so that there is no irritation to the gingiva. So basically we are giving space for the teeth to erupt, and moreover we are not letting this teeth to drift here. So we are stopping the teeth from drifting, so that the eruption of the permanent teeth is nice and smooth and it comes to in its position. And we do not want to impinge the soft tissues or the tongue, so we give enough space to allow the permanent tooth to erupt. We ask the patient for the follow-up for like 3 to 4 months. So this is about band and loop. We are placing a band, and then like this band is placed 1 millimeter of the gingival tissues, but it should rest against the adjacent tooth contact point. So, and we have placed a loop to this band, and this loop is soldered to the band and providing enough space for the eruption of the permanent teeth. So this is the band and loop. The band and loop also we have some modifications, like we have the bonded loop. So instead of band we are doing the bonding with a composite resin, bonded loop, but it is not used. Then we have the crown and the loop. So crown and loop is, instead of banding the teeth, we are giving the crown. So instead of banding, like this was band, right? And then there was this loop. Instead of this, we are giving a crown, whole crown, complete crown, and then a loop is there. So the benefit of crown and loop is, say suppose if the tooth is highly carious, or if there is hypoplasia of the enamel, all these cases already we need to give a stainless steel crown. We are soldering the loop to the stainless steel crown, and stainless steel crown is fitted to the abutment teeth, or if you are doing any pulp therapy. So guys, band and loop space maintainer, if we have to summarize it, it is given in the unilateral space lost. So unilateral loss if is there of the primary first molar, which is D. So primary first molar before or after the eruption of the 6, which is the permanent first molar, or you can give when there is loss of the E, but it is before the eruption of the permanent incisors. It is easy to construct. Then it will not also prevent the eruption of the opposite teeth, but it is limited to only a single tooth space, maintenance of the single tooth space, right? So used in the unilateral cases. So this you have to remember it, that it is used in the unilateral tooth loss, maintenance of the unilateral tooth loss. Next one over here in the diagram, guys, we have is the lingual arch space maintainer. So you can see that It is present on the mandibular teeth. So that is why lingual, and it is gone lingually. And if you can see here guys, that the arch wire is resting on the incisors. So cingulum of the incisors, cingulum of the incisors, and also you can see a loop which is present mesial to the first molars. So this loop is the Wilson loop or the U loop. This is just to have some length if you want to do some adjustment or something. So lingual arch, you can see it is present on both the sides. So it is used for bilateral, single or multiple tooth loss in the mandible. So it is used for bilateral and the mandible, single or multiple tooth loss, multiple. But can you give it in wherein there is no primary incisors? No, we cannot, because it is resting on the primary incisors. So it is not recommended when the primary incisors are still present. I mean the permanent. See, you are resting on these permanent incisors. So if there are still primary incisors, you cannot give it. Once the primary incisors are shed off, the permanent incisors have erupted, then you can rest this lingual arch on this arch wire on the cingulum of the permanent incisors. But you have to make sure that it is 1 to 1.5 millimeter away above from the gingival margin, so that there is no impingement. Next one in the diagram we have over here is the transpalatal. You can see it is present on the palate. So transpalatal arch. Now the transpalatal arch is, it is across the palate, and you can also see that it is given in the maxillary, also bilateral. Same as the lingual arch. Lingual arch is given in the mandibular teeth loss. Transpalatal is given in the maxillary teeth loss, maintaining the space in the maxillary. Next one over here we have is the Nance arch. So again it is given in the maxillary arch when there is a bilateral tooth loss. And you can see that arch wire is resting on the palatal rugae. So on the palatal vault. Next one we have guys is the distal shoe, which is very important. Distal shoe appliance, or we also call it distal shoe space maintainer or intraalveolar appliance, because it is going inside. So you have to do a surgical procedure while you are constructing this appliance, or during the extraction of the primary teeth. You can insert this appliance, so that there is no extra surgical procedure which you have to go for. So guys, initially there was gold or velvet distal shoe, which is initially, but it is not used anymore because there is a lot of complication, fabrication, difficulties, tooth preparation which is required with this. Now we use the Roche. So the Roche distal space maintainer. Now what happens guys? Again I'm gonna draw the same thing. Say suppose this is your D, say suppose this is your E, then there comes, we have to, this time we have to make the gums as well. Say now here the first permanent molar is not erupted, It is still erupting like this. So what happens if there is loss of E, right? So this is D, this is D. Then now we have this time there is loss of E. Now we know that when the 6 is erupting, it will drift mesially. We do not want this to happen. We want to maintain the space this time. So what do we do in order to maintain the space for the first permanent molar after the eruption after the loss of the second permanent molar? We are going to maintain this space, and how do we do this? We are going to put a band at the D, and then guys, make a loop which is going inside the gingiva. Now we know once the permanent teeth is erupting, guys, it will erupt like this. So it will erupt like this. So it is going to take support of this end of the loop. So this is how it is going to determine the path of eruption of the 6th, the permanent first molar. That's the use of the Roche distal space maintainer. So first primary molar is bonded, or it is say crowned, any of it, and then into the gingiva we are going to put the distal portion. We are going to make a loop going inside the gingiva. So either if it is, best time is when you are extracting the second primary molar. So when the tissue is already opened, you are going to put it inside it. So if you can see over here that it is placed inside the socket, or if it is like healed socket or anything, then you have to give the anesthesia, make the incision, and then you have to go intragingivally. You have to extend it intragingivally. You have to go inside the bone. And while you are constructing this appliance, guys, you are making in the stone cast. So you are taking all the measurements with the help of a divider, like taking the radiograph, measuring the distance between the first primary molar and the mesial surface of the unerupted first permanent molar, and then you are going to construct this on the cast and then take everything and insert it in the patient's mouth. So this is how you are going to make this distal space maintainer. If you can see here, this is unerupted, right guys? So this 6th teeth, which is the first permanent molar, it is taking the course of eruption according to the distal shoe space maintainer, and that's the added benefit of the distal shoe space maintainer. To maintain the space of the E which is lost, right, second primary molar which is lost before the eruption of 6. So before the eruption of first permanent molar and after there is a loss of the primary second molar, we are going to maintain space for the first permanent molar. Now usually the distal surface of the E, it provides the guides for the eruption of the 6. So 6 erupts like that, but since there is no E, then the eruption can be mesially, and we want to prevent it, and for that we are giving the Roche distal space maintainer. I think that you are familiar with all of the space maintainers. Now let's see in a table form, let's see if there is early loss of A and B. So situations, if there is early loss of, right? So first one we have is when there is early loss of A and B. So we are talking about the primary incisors. If there is early loss of A and B, there is no big deal. So what we can give is, we can take the lingual arch with acrylic teeth. So we are in fact doing the aesthetic part also. We are putting the acrylic teeth. So we can give lingual arch with the acrylic teeth. What if there is early loss of C, which is the primary canine? So guys, if there is early loss of C, then it can cause the lingual collapse of the incisors. So therefore there can be loss of the arch length. So if it is in lower, then we can give the lower lingual holding arch, which is LLHA. If it is an upper, then we can give the Nance holding arch. But before giving this lower lingual holding arch, wait for the lower permanent incisors to erupt. Otherwise they'll be trapped, because we know that in the lingual arch, guys, what happens? In the lingual arch is a loop. What happens? We are taking this support from the anterior teeth, right? Lower anterior teeth. So there will, like, otherwise the permanent teeth won't be able to erupt properly. So the next one we have is, if there is early loss of D, that is the primary first molar. Not a big deal. We can put, if it is on one side, unilateral, we can give the band and loop, or we can, a bilateral if there is, we can give the lower lingual holding arch or the Nance. So lower lingual is for lower, Nance is for upper, right? It is for bilateral. What if there is loss of E, which is very, very, very important, guys? So if there is early loss of E, this should be maintained ASAP. So very important. What we have to do is, we have to give a distal shoe, which goes, so we band the D and then we put an extension that goes, so say suppose this is the D, we band this D, we take this extension that goes into the gingiva and it provides a guide for the eruption of the 6. So this is the 6, the unerupted first permanent molar. So this is how we maintain the space. But guys, distal shoe space maintainer also is contraindicated if there is a heart problem. So if there is a heart disease, the child is having endocarditis, or if there is a poor oral hygiene, or if there is any bleeding disorders, say hemophilia. All these situations, because it requires the surgical, a slight surgical procedure, so that is why it is contraindicated. But the most important thing which you have to remember is, a properly restored deciduous teeth is the best space maintainer. Because nothing is better than the original teeth. So a properly restored deciduous teeth is the best space maintainer. So guys, if there is a bilateral premature loss in the mandible, we give the lingual arch space maintainer. If it is in the maxilla, we give the palatal or the Nance palatal arch. If there is early loss of E before the eruption of 6, if there is early loss of the primary second molar before the eruption of the permanent first molar, then we give the distal shoe space maintainer, and it is the most indicated condition for the space maintainer. So if there is early loss of E, then we have to give the space maintainer immediately, as soon as possible. If there is a unilateral space loss, then we give the band and loop space maintainer. So that's about space maintainers. I hope that you have enjoyed this video. If you have enjoyed this video, give it a thumbs up. Also guys, comment in the comment section below because this motivates me to put videos for you every day and to make free notes. You can also support me on Paytm as well as on PayPal to make free videos for you guys and to make free notes. So till then, keep reading, keep learning, stay motivated. I'll see you soon in the next video.